We have good visualization of the target area.
Connect the ultrasound to the stereotactic frame.
Ablation won't work.
You changed your mind? You don't think he has dystonia?
He does, but it's a symptom. His vertebral artery takes an aberrant course. It is pressing against his spinal cord. He needs vascular surgery or he'll die.
We want to run a vertebral artery BTO. If you tolerate it, then we would
Sacrifice the vessel with onyx embolization.
We recognize you might not love this proposal.
The one in which my hand weakness remains, destroying my career? Did you consider vertebral to vertebral artery bypass with physical removal of the aberrant artery?
That would carry a very high risk for a stroke or bleed.
It would fix the dystonia and let me get back to work.
With your history of carotid stenosis, it would be a coin flip whether you survive.
I can live with those numbers. Or, for that matter, die with them.
We've decided to use your radial artery for the graft. You've scheduled an OR for tomorrow morning.
Good call.
I agree. You should risk your life for this surgery.
Are you being facetious?
No.
It just boggles the mind. You can't understand what anyone means. You can't express yourself like an adult. You're a child playing dress up. And everyone here just plays along.
Let's go, Shaun.
You're agitated.
I'm fine.
You are rubbing your mug. People with ASD often have comfort objects for when they become agitated. I can order you propranolol.
You're going to give me the Ruseckus-Friedman ASD diagnostic questionnaire, and that's going to shut your damn mouth.
Okay, the RefEdQ is just a tool. An official diagnosis needs to come from a psychiatrist.
Well, since I might be dead tomorrow, this is your next best option.
I'll get the test. I frequently point out other people's mistakes.
Duh. That's a yes.
People tell me I overthink things.
Only people who underthink things. But fine, another yes.
I sometimes speak in an abnormal tone.
Who thinks they speak in an abnormal tone? Just mark no. How many more of these?
None. Your answers are fully congruent with someone on the spectrum.
You keyed it wrong.
No, look, no.
For something. Here.
Look, I didn't.
No, give it to me.
No.
Oh, don't! You idiot! Stupid, careless.
I stepped back.
Get out of my room! Get out!
Okay. On my first day here, Dr. Melendez said I would never do anything besides suction, but later he let me make my first surgical incision. He became my friend. I miss him.
Are you in the right room? Did somebody tell you I needed pointless stories?
I used to think being a doctor was all I needed to make me happy. It did make me happy. But I realized I wanted more, and that I could have more. I changed. You can change too, but not if you're dead from this surgery.
I've made up my mind. Please leave.
My brother Steve, he gave me a plastic scalpel before he died. It broke. I was very sad.
I asked you to leave.
When I fixed my scalpel, it made me feel better.
This last segment of tumor is holding on to her spinal dura for dear life. Find dissecting scissors.
I may be participating in fraud, but I want to support my partner.
If your partner wants you to do something that makes you feel uncomfortable, shut it down. Do not enable crazy.
Leah isn't crazy.
We're all crazy sometimes. Just takes the right motivation.
There's an obvious middle ground. If you think your partner's doing something wrong, help them see what's right. Damn it, the capsule ruptured and it tore the dura. We have a CSF leak. We should try a graft, harvest some fascia to reinforce the dura.
Dr. Lim?
Days like my birthday. Lab confirms the tumor wasn't metastatic. You're cancer-free. And brain function is apparently fine.
Oh, well, it's been a pretty good day.
10 years. Miss anything good?
No.
So why'd I wake up? We're running tests. There have been cases of anesthesia rebooting the dormant brain. Yours was light, but it still might
Let's
have...
just call it a miracle.
Your dopamine levels are dropping quickly, and when they return to normal, you'll return to your comatose state. What?
No. Look at her. She's lucid. She's talking and laughing. She's fine.
I'm sorry.
That's it? There's no treatment, no surgery, no medication?
Elias, I wish we...
No!
How long do I have?
Less than 24 hours.
But she could wake up again, right? I mean, you didn't think she would this time. You said she shouldn't have.
This series of events that coincided to make this happen was so unlikely, it is safe to say it will never happen again.
I want to see another doctor.
Elias.
There must be some way.
Elias. We have to face this.
Why? Because they say so? Listen to me. You're right here. Looking into my eyes and holding my hand. You're not going anywhere, Danny. I promise.
It's a DNR. I don't want to be put back on life support. That's not life.
You gave her this.
But I signed it. Do you remember our first Valentine's Day together? You gave me that silver pendant with the 2 little hearts. I told you I was considering that job in Boston. And you let me go.
You didn't need my permission.
I know. I know. But you knew that it was something that I needed to do. And you also knew that I was scared.
Danny, this isn't Boston. I can't let you go.
I know. I think that's why I woke up.